First on the American health front, every day thousands of women face the prospect of surgery.
Today, minimally invasive techniques allow highly skilled surgeons to perform the majority of operations without large, painful incisions and on an outpatient basis. We spoke with one of Southwest Florida's most accomplished OB/GYN physicians, Dr. Michael Swor at Swor Care, who has dedicated his practice to performing minimally invasive and advanced laparoscopic procedures. Dr. Swor has also shared his expertise by training many other surgeons across the nation and the world.
Our ability to perform major operations through small incisions that used to require large incisions has really revolutionized GYN surgery. We call this advanced GYN surgery. In our office, we do a thorough workup of each patient, including often what we call a clinical transvaginal physician-performed ultrasound. And basically, it allows me to get a real-time look with ultrasound of the patient's anatomy and assess her problems. I think that the transvaginal ultrasound done by the physician offers a big advantage over the usual way that ultrasound is done, where the patient goes to a facility, a tech does the procedure, a radiologist reads those images, and then passes a written report back to the physician. We like to do everything with the assessment clinically at the same time.
Now Dr. Swor tells us about a few of the procedures he performs.
Almost always we're able to do surgery in a minimally invasive fashion, what we call laparoscopy. Laparoscopy is where I take a little scope, make a little incision in the navel, insert the scope, and then we use other smaller incisions to insert other tools to be able to look at and treat problems in the pelvic area, gynecologic problems in the pelvic area. One of the most common procedures that we do here at Swor Women's Care is advanced diagnostic laparoscopy. And this is how we will commonly end up not only assessing certain problems that women have, GYN problems, but actually trying to fix or correct those problems at the same time. A good example is a woman comes in with pelvic pain, and we'll use laparoscopy to look inside, see what's causing the pain, and actually treat it at the same time. We see a lot of patients who have bladder issues, and bladder issues can range from leakage to difficulty with urinary frequency to recurrent infections to prolapse, or dropping of the bladder as it's commonly called. One of the minimally invasive procedures that we have available now is a simple mid-urethral sling. And that's where we take a little strip of mesh and insert it just under the bladder neck to give extra support, which helps prevent leakage in certain situations. And the surgery is relatively easy to perform. It's done on an outpatient basis and with a fast recovery and a really excellent success rate. Some patients that we see have problems that are significant enough that something needs to be done that's in the hysterectomy family. And we do have many alternatives to hysterectomy, but when something like hysterectomy is required, we choose a procedure that's ideal for that particular patient. And it may be a total laparoscopic hysterectomy where we remove the whole uterus. It may involve removal of the uterus and ovaries. It may involve a less invasive version of hysterectomy that we call the LASH procedure. The LASH procedure, L-A-S-H, stands for laparoscopic supracervical hysterectomy. And it's been a great advantage for a lot of our patients because the surgery is less invasive, the healing time is much faster, and it doesn't involve as much cutting into certain areas in the pelvic floor. It's done as an outpatient. Patients typically go home the same day, and after about 1 week, we let them get back to most of their normal activities. Although we've been doing laparoscopic GYN surgery for many years, there's been another new advance that's, I think, significant, and that's Da Vinci robotic surgery. The movements are more magnified. I think the surgery is more precise. I do think that it's some advantage for the patient as far as faster healing and faster recovery.
Swor Women's Care, dedicated to state-of-the-art gynecological treatment for women's healthcare needs.